Now, patients infected with HIV undergo various types of disease progression, which in turn depends on various factors like viral factors, host genetic makeup, and environmental factors like coexistence of other diseases like tuberculosis and hepatitis B accelerate the disease progression. About 80 to 90% of HIV infected individuals are typical progressors with a median survival time of approximately 10 years. Following infection, HIV is carried to the lymph nodes and other lymphoid tissues where further multiplication occurs inside the T cells. Initially, HIV destroys the infected T cells and spills over into bloodstream to cause primary viremia, which coincides with an initial flu-like illness. There is a significant drop in the numbers of circulating CD4 T cells at this stage. Then there is the asymptomatic stage or clinical latency. Adequate immune response develops within 1 month in most of the patients. Both effective cell-mediated immune response and humoral immune response come into play. Viremia drops, CD4 cell count becomes normal. It is important to note that this is a state of clinical latency but not microbiological latency. The immune response cannot clear the infection completely. The HIV infected cells persist in the lymph nodes and there is a high level of ongoing viral replication. This period of clinical latency is variable, may last for 10 years but ranges from few months to 30 years even. Once the latency is broken, the disease progresses rapidly and the death usually occurs within 2 years if left untreated. Then there is a stage called persistent generalized lymphadenopathy. As a result of HIV replication in lymph nodes, 30% of infected people who are otherwise asymptomatic develop lymphadenopathy. That is, lymph nodes are of more than 1 centimeter in size in 2 or more non-contiguous sites that persist for at least 3 months. This is the definition of persistent generalized lymphadenopathy. Then comes a symptomatic HIV infection or AIDS-related complex. After a variable period of clinical latency, the CD4 T cell level starts falling. Eventually, patients develop constitutional symptoms such as diarrhea, weight loss, fever, malaise, etc., oral thrush. Gradually, the patient moves towards the advanced end stage of HIV infection called AIDS, characterized by rapid fall in CD4 T cell count, high viral load, lymphoid tissue is totally destroyed, and some opportunistic infections set in secondary to profound immune suppression or development of neoplasia. So, hope you understand the different stages of the natural progression of HIV infection and finally to AIDS. Now, there are some clinical classification also. Clinical staging by WHO. Clinical stage 1, asymptomatic HIV infection, persistent generalized lymphadenopathy. Clinical stage 2, unexplained moderate weight loss, recurrent respiratory tract infection, herpes zoster, recurrent oral ulcers, like this. Then clinical stage 3, severe weight loss, chronic diarrhea, oral candidiasis, severe bacterial infection, and so forth. And clinical stage 4, HIV wasting syndrome, characterized by profound weight loss, more than 10%, chronic diarrhea for more than 1 month, and prolonged unexplained fever for more than 1 month. So this is the clinical staging set by WHO. You must remember that because of this depletion of T cells, there are opportunistic infections that take place in HIV infected patients. The bacterial opportunistic infections are maybe some extrapulmonary tuberculosis, disseminated non-tubercular mycobacterial infection, recurrent septicemia, including non-typhoidal salmonellosis. There may be viral opportunistic infections like chronic herpes simplex virus, then cytomegalovirus, fungal like pneumocystis jirovecii, esophageal candidiasis, coccidiomycosis, histoplasmosis, then parasitic like toxoplasma encephalitis, cryptosporidiosis, leishmaniasis, and neoplasia like Kaposis sarcoma, cervical cancer, and lymphoma. Other conditions like HIV encephalopathy or nephropathy or cardiomyopathy may also set in.